The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance.
Okay, Brenda, thanks for joining us today. Talk first about career readiness. What in the way of knowledge or awareness in general of career readiness do you see a lot of residents lacking?
Right now, a lot of the residents are not knowledgeable in, for example, what a contract looks like. So as a resident, they might never see an actual contract before they're actually signing a contract for their very first clinician job. So that's one of the big things that we're noticing. They're not aware of, if they have a buyout in their contract. They're not aware of what's the overhead cost or percentage in their contract. They're not necessarily aware how to negotiate a contract. So we're finding that the residents don't necessarily have the power in negotiating because they're not knowledgeable of the different components. So that's one of the very first things that we like to teach the residents. We want them to be successful in their next job, regardless if they're not staying at one of our own hospitals, because it is a reflection on how well we teach them for that career readiness. So it's important for us to get them to understand the basic knowledge of what they're signing, just like you would for your own child who's going to sign a student loan or a car loan. But there's other components too. So we look at the compensation models. There's many physicians that are out there that don't have enough experience understanding how they could get paid. There's different options that might be different for a salary employee, such as myself. I work in administration, so I don't get any type of percentage of a pay of any type of bonuses. I just get a straight, flat fee. Residents mostly don't have any other careers under their belt, so this would be their very first paid job, and they're not asking the right questions. And it's not just about, well, how much is my salary, or let me negotiate my salary. There's different types of tiers and structures that they're going to get paid on, and we need them to be knowledgeable in that as well.
And there's probably some general standards that go along with that. If there are bonuses and different types of compensation models, I would imagine these contracts tend to be more complex.
They are. I mean, everybody knows about the RVU systems, but what is typical in a specific area or what is typical in a field? So a surgeon is going to have much different than a family medicine doctor. So we don't want residents to hear the chatter amongst their peers. We need them to understand, hey, just because this person out in San Francisco is getting this much doesn't mean you in Alabama are also going to be getting the same. There's obviously different factors that go into different price models, and we need them to be educated on that. So a lot of what we do is overlapping, but then we get specific. So if I were to go do a presentation in, let's just say, Nashville, of course, I will do the basics of, hey, this is what a contract is, the basic contracts that all of residents are going to receive. But let's look at more towards Nashville. Let's look at the employment trends in Nashville. The market value. This is what's going to be typical. Same thing if I go to Minnesota. Same thing if I go out somewhere in California. I'm gonna break it down to that specific general area.
So the complexity. So this kind of begs a question for me. Do you have any information on where they go to get help currently? Is there any sort of, do they really go it alone, or is there sort of a pat answer that you typically hear on the tail end about how residents would go about even getting help, or do they even try to get help?
That's a good question, and I'll tell you, I spent the last 10 years working in graduate medical education. So I've worked in the G&E office, or I've worked as a program administrator for example, psych or general surgery. I've worked for a couple of different specialties. And what the issue is that ACG&E or the different boards, for example, there's no requirement that programs have to teach career readiness or transition. So the residents really don't have the information. Program directors aren't going to be spending their time researching the different hiring trends or negotiation contracts or interviewing techniques with their residents when they've got so much more that they have to teach them. So this is really all outside information that residents are getting. They're not necessarily getting it into the program. So when I was working in GME, I never heard of a program that was doing this on a constant basis. What happens is that the program has to kind of outsource, if you will. So different companies like mine, like Universal Health Services, contact me, for example, to go do a presentation. Residents can definitely get the information from their different peers, but what we're finding is that they don't know what they don't know. So the example I gave earlier of where somebody from Nashville is going to be talking to somebody in San Francisco, and they think, oh, well, if this is what someone's getting that's going to work at Stanford, I'm going to ask that for my community hospital here in Nashville. And they're not going to be taken respected because two different markets, really two different population groups, if you will. So what can the residents do? Sure, they can definitely talk to their peers. They could try to Google and research the information. But just like any other job that's out there, not everybody is going to display the perks and benefits and salaries that they're getting. So it's great if a residency program can contact someone like myself who has all of the research already done and the knowledge and go to the program and speak directly to the residents.
Yeah, that makes a lot of sense. So let me kind of flip the role here a bit. What are some of the common complaints or frustrations hospital CEOs or CMOs are telling you when they're working to hire residents for their first clinical job?
So there's a few. And I think what the bottom line is that residents themselves aren't being coached on the interviewing process. So this isn't like going into college. This is going to be hopefully their lifelong career. So they're not necessarily knowing what questions they need to ask whoever they're interviewing with, the CMO, CEO, the program chair, etc. So what we say is that we're getting a lot of dead air from the residents. They're listening, they're being receptive to what the interviewer has to say, and then we're expecting questions to be coming from those residents, but they don't have any questions.
Yeah, I can see that. Just general interview preparation. They're kind of going into it blind.
Correct. And there is a right time to ask certain questions. For example, obviously we know about the salary or bonus or even stipends that they may receive. You probably don't want to ask that right away to the CEO. You've got other type of important questions like, tell me about the community.
Yep.
That's a really
Patient
big question that I think.
Yeah.
Exactly. It's a really big question that we would like to hear that's, coming from a hospital to say, are they engaged? Because you've got to really, fit into the community, and you've got to look at the area and say, yes, this is who I am. This is the right energy for me. This is the right environment. This is where I can see myself for the next 10 years. So we're looking for long-term type of questions to really engage how interested they are. And that brings me to the other frustration that we're seeing is, sometimes because it's so hard to engage their interest, it's almost as if they're saying, are they taking these interviewing opportunities just to take the interviewing opportunities, which isn't good. You don't necessarily want to ruffle anyone's feathers or waste any CEO's time or CMO's time. You really want to have at least maybe a good 5 companies that are hospitals that you want to interview with. And if you're kind of on the border with another one, or I'm not sure, but let me go for the practice, or I'll just hear what they have to offer. The CEO can definitely see that you don't have an interest, and that's very disheartening because if you know their schedule, of course, and how hard some of these jobs are to fill, you want to be respectful of their time and not waste it. So it's not like you're going for a residency program and you've got 25 interviews under the belt, and then closer to the ending of match, you say, okay, I can let go of these interviews because I've interviewed with these other interviews and I know I'm interested. I'll just send them an email and cancel. You don't want to do that for your job. This is a very small field. You're going to run into each other at some conference down the line. You don't want to ruffle anyone's feathers. So it's just situations like that, asking the right questions, knowing when to ask the right questions, taking the interviews that you really are genuinely interested in, making sure that you do your own research. A lot of residents aren't necessarily looking up that hospital's information. They're asking very basic questions, if any, that they could have gotten on the website. So do your research, do prepare before you go out for a job, because it is a frustration that is showing. And I would say another issue that we get, which is surprising to me, is when they do cancel. Most of the residents are working with a recruiter first and foremost. It's very simple to pick up the phone or send an email to the recruiter and cancel. But unfortunately, they have missed that step. And so now the CEO or CMO is waiting there and isn't aware that this person canceled because they didn't reach out to anybody. We get that a lot, actually. That's a very common complaint. So again, this isn't like residency where you can do that as a coordinator. I've had prospective residents also cancel on me and didn't tell me. But that's not acceptable when you're going for your job.
Yeah. Well, that's so we've kind of touched on knowledge of the market. We've talked about prep and interview process and things. What's probably, or can you share maybe a punch list of career transition services that can help residents be more knowledgeable and successful in the career process? Because you named a few, but what's probably like your quick punch list of things of
Sure.
career transition services that can help?
Sure. So, for example, for me, something that I go down and present on is in the contract negotiation and employment models that I talked about, CV writing and formatting, which is absolutely important. What residents are doing is taking their CV from med school and just throwing things in it, but they're not getting it professionally looked at. But that is so important, just like for you and I when we go out for a job. You want a professional CV formatted correctly. We also do talk about career planning 101, kind of what to expect during the negotiation process, but also working with a recruiter. So a lot of these residents are getting calls all the time or getting emails the time about working with recruiters. And there is a difference between in-house recruiters and out-house recruiters. So if I, from a hospital, I'm not a recruiter, but if I, from a hospital, I'm going to call you for a position within one of my hospitals, I'm going to treat the whole situation differently than, a recruiter that works for a firm and has probably 30 other jobs, and I'm, making random calls just to anybody. And I'm not saying that's a good way, and I'm not saying that's a bad way. I'm just saying there's different approaches between the two, and so we talk about that. So residents kind of have an idea. It's always good for them to know the different kind of recruiters that are out there and how they can help you, the pros and the cons, so to speak,
Yep.
So we also do talk about, what is the difference between being an independent contractor, the 1099 versus the W-2? This also is very amazing to me how basic of a knowledge that residents have when it comes to their own taxes. And I understand, we want to talk about setting up their business. Do you want to be a 1099 or do you want to be a W-2? So we go and speak of the different pros and cons for both. Again, neither is better, neither is worse than one or the other. It's just what fits for you at this time in your life. Yeah. So we go over the basics of that, try to set them up best as we can. And we also talk about such things as professional liability insurance, which is, of course, mandatory. It's something that they're going to need, but who's going to pay for it? How can you negotiate it? Can it be in your contract? Yeah. We want to take a look at that. We also talk about the onboarding process and what they can expect with licensure and credentialing. That is something that residents don't necessarily have full knowledge of, because when they go into residency, they're usually sending all their paperwork to the GME office or the program coordinator, and they are the ones that are doing it for the residents. But now, they're going for their actual first job, and there's going to be a lot more work on their end that they're going to have to do. And, I'll tell you, it can take months, depending on different states. It can take 6-9 months for the whole licensing and credentialing process to come to fruition. So what is, a prospective employee going to do for that period? They're going to be working without some time.
Well, that's huge. I mean, and it's such a big step, and there's so much to consider. It's really pretty sad that that the environment is such that they're just kind of stepping out there. So that's really, I mean, you're touching on really big things. So I guess when should residents start preparing for a career transition? Because there's a lot of stuff, as you've talked about, to consider. When's a good time to start? At what point?
So I would say before they end their second to last year. They want to start getting serious about where they want to work. And they can break it down to a region. They can even break it down to a state or a city. They need to start feeling the area, say, okay, I'm going to spend my time here. They can either connect with the recruiter themselves. They can be proactive about it, or they can wait for a recruiter to contact them. But really, what's going to happen is that they're going to do probably anywhere from 5 to 7 interviews, and then they're going to have to, go through the negotiation process, and they're going to have to go through the back and forth between them and their prospective employer, and then the credentialing. So they're going to be looking at, like I said, a good 6 to 9 months of just going through the actual onboarding process. So they want to do that while they are still in their last year. So by the time that they graduate, maybe, if anything, they'll have a month to where they have a downtime before they start their new job. But if you're going to start the process, if you're going to start getting serious during your last year, then you're not going to have enough time to get all this done. You will have months that go by that are going to be a downtime where you're not going to be working. So really start thinking about it before the second to last year. You get at least the region where you want to go, and then start doing the interviews right when you get into your last year.
So that's a busy year for them.
Yeah, very busy. It's very busy for these residents during their last year because, obviously they're focusing on graduating, but they're focusing on their future too. So it's a lot of stress for them. Wow.
That's good to know. And it is such a long lead-in time that you really, getting started early, that's a big deal. So what are, I guess, maybe some core fundamental questions that a resident should ask a future employer? We talked a little bit about the interview process, but what are some of those, top 3 things that they should always be sure to ask a future employer?
Okay, so one of the first questions that you want to ask is about the practice culture. Like I mentioned before, you want to make sure that not just the community that you're going into has the right environment, but you want to know that where you're going, the hospital you're working at, or the practice has also the right environment for you. So you want to ask about the culture.
Yeah.
You also want to ask about the practice economics and growth. That's always a good question that CMOs like to hear, that you're serious about being there for the long term.
So what realistic expectations should residents have during the negotiation process?
Sure. So first they need to understand the time that it takes. I think that's the number one frustration that residents are stating, and that's something that we have to explain to them is it's not just the recruiter that they're working with that's working on that contract. So when the recruiter gets the different demands, if you will, from a prospective employee, they have a team that they have to take it back to. And then that team has the lawyers that they have to take it back to. Yeah. So it's a lot of back and forth, and we don't want residents to get frustrated on that. It's a normal process. But what they should also be realistic about is knowing that they can negotiate those components, the different components on the contract. But first they have to be educated on those different components.
Right.
So also, realistically, they need to know, what's in there, what's not in there. So, we've come into situations where residents have come back to us and said, for example, I got a stipend. I decided that during my last year of residency, I was going to agree to work with XYZ hospital. They're going to pay for my last year. of residency, but I don't see if I leave by a certain time whether or not I have to pay that back. Now, in most situations, if the resident decides to take up that opportunity, they do have to pay at least a portion of it back. If it's not in the contract, you definitely need to ask about it.
Oh, yeah, absolutely.
So again, it's a lot of what they don't know that they should know. And it all comes down to first being knowledgeable of what a contract looks like and what the components look like.
Yeah, and all this there's so many pieces and parts, and it's such a big step that, and again, the transition process, that last year of residency when you're doing all this, is sort of like a perfect storm. So I think the big takeaway here for me, learning about this kind of at the same time that you're telling us here, is that you need help. And where to go to get that help. And that's why Southern Medical Association is focused on, simplifying the business of medicine process. There's so much to it. And you've touched on a lot of them here, and I'm sure that there's a myriad of other issues we could talk about. So we'd really love to invite you back to discuss this again and maybe even host a more comprehensive webinar in the future. Does that sound good?
That would be great. I think a lot of residents would love to hear the type of questions that they will be asked during the interview process. That's always been a very popular, highly requested presentation. So if that's an interest, I would love to come back and talk about what questions they can expect to be asked by CMOs or CEOs, or even at the initial stage of working with a recruiter.
Excellent. Well, thank you very much for joining us today.
Thank you. I appreciate you having me.
Would you like to learn more about this topic? Make plans to attend SMA's Southern Regional Assembly October 31st through November 2nd in Birmingham, Alabama. Visit sma.org/assembly for more information and to register.